Warning, this story contains images that may be shocking to some viewers. Viewer discretion is advised. From butt injections to facial fillers, many have gone to great lengths for an illegal glow-up, even traveling overseas.
Seeing women lined up in wheelchairs returning home from getting cheap out-of-state, even out-of-country procedures are common at certain airports.
But while black market procedures might be cheaper than the real deal, they could cost you your life.
These women all reportedly died after having butt lifts.
Why were this mother and daughter charged with murder?
Is there anything you want to say to these families?
How did this woman end up with cement in her face? And what happened to her nipple? This is Your Body On Black Market Cosmetic Surgeries. Illegal cosmetic procedures are performed outside the medical profession's legal regulations, which means there are no rules.
It's an epidemic that's actually getting worse as social media is becoming more popular.
These procedures can range from injectable treatments like Botox and fillers to surgical procedures like liposuction and breast augmentation. They may look safe and affordable on paper, but these black market surgeries could ruin your life and even end it.
I paid, under $5,000 to have this done, and it's costing me my life at this point.
People were looking at me and laughing at me and taking me as a joke.
If you could go back in time and tell yourself something beforehand, what would you tell yourself?
That I was good enough and I didn't need to do this.
Our first story is about a woman who risked it all for a bigger backside. Taryn Quinteri, butt injection gone bad. This is Taryn Quinteri, a business owner and tattoo artist from Phoenix, Arizona. She specializes in camouflaging scar tissue. Growing up skinny, she felt self-conscious about her small butt and dreamt of getting a Brazilian butt lift.
Growing up, I wanted to be a little bit thicker. I didn't like how skinny I was.
In Taryn's case, she was too petite to use her own fat to top up her tush and opted for a more dangerous approach.
There was nothing really available for me at the time. I couldn't get a BBL. I didn't have any fat to transfer.
Feeling hopeless, she looked far and wide for an under-the-table solution. Then she came across a mother-daughter injecting team, Libya Dame and Alicia Galaz, who seemed trustworthy at the time.
I reached out, I talked to them, and she had done her own daughter, so, I completely trusted her.
In 2017, she bit the bullet and traveled to a swanky Vegas hotel to get her shots, joining a long line of desperate women like her in the hallway.
So I went ahead and did it, and I loved it at first. Everything was amazing, and then all of a sudden I developed a rash, and it was just on my butt cheeks, so I knew it was the injections, and I knew something was wrong.
Over time, the rash spread and became excruciatingly painful. Scared and overwhelmed, Taryn visited multiple specialists to find out exactly what was injected into her body.
It doesn't even matter what's injected. It's stuff that doesn't belong in your body. It's not sterile, it's not processed. In large quantities, it's not allowed. People's bodies react to stuff all the time.
Believe it or not, the Federal Drug Administration only approves injecting your own fat into your body. Anything else, like silicone, is off the table. Why? It could lead to poisoning or even death.
The problems that people tend to have are autoimmune problems. They feel tired, they get back pain, they get burning and itching in their butt. Their legs feel heavy and numb, they have difficulty walking. Sometimes it's 3 weeks from the time of injection, sometimes it's 30 years later.
The more Taryn learned about the dangers of these injections, the more she grew weary about the future.
I could end up on dialysis in 10 years. The product could migrate into different parts of my body. I thought, okay, I I have to tell my mom that I might not be around to take care of her when she's older.
In 2019, the mother-daughter butt injection duo was charged with the murder of another woman, Carissa Rajpal, who died after allegedly getting injections from them, according to ABC News.
The daughter is part of what made me feel okay doing it, because she was like, look, I have them. The daughter definitely helped sell me.
Shocked and saddened by the news, Taryn saved up enough money to pay for a full surgical removal of the injected fluid in her buttocks. And it cost a whole lot more than her illegal injections in Vegas.
My surgery was 7 hours to remove them, and I still have quite a bit of product in me. I'm going to have to go through it again at some point.
While Taryn's reversal was a success, she's not the only woman whose life was put in danger from a black market glow-up. Raji Narinsingh, cement face filler. 48-year-old Raji Narinsingh had a terrifying problem. Her face was filled with cement. Yeah, you heard me. Cement.
I went for what I thought was medical silicone. That's when I found out that these injections that I had been getting were a concoction of cement, tire sealant, and glue. I had a horrible reaction in my face. It was devastating.
Raji is one of 30 victims disfigured by this woman, O'Neill Morris.
A woman who came to be known worldwide as the toxic tush doctor.
Police say this person injected a patient with cement, and that is just the beginning.
O'Neill posed as a nurse and invited victims to her house to receive injections for extremely discounted prices.
Medical grade silicone, and just this bottle is about $500. And that's why a lot of these people do it. They hear you can get your face pumped up for $300.
Raji paid just $100 per session. Like most of O'Neill's victims, Raji is transgender, and she was desperate to feminize her appearance.
You want so badly to match the way your outside feels with the way you feel inside, that you're willing to roll the dice and take chances.
Unfortunately, Raji took a chance with the wrong woman. It started with a large boil on her face that kept getting bigger and bigger. Large lumps formed under her cheeks, lips, and chin in no time. As a result, she spent years in solitude, fearful of being ridiculed.
People were looking at me and laughing at me and taking me as a joke.
Thankfully for Narinsingh, she got help on the plastic surgery show Botched. After a few careful procedures, the doctors removed the cement, taking a literal and figurative weight off her shoulders. Our next victim got less nip than tuck on her quest for a makeover. Lindsay Colosimo, breast reduction nightmare. Lindsay Colosimo from Delray Beach, Florida, dreamt of a perfect beach body, so she traveled to Colombia for a deadly discount.
I didn't feel good about myself. And I thought I would be coming home and being able to put on a bathing suit and go run around and look cute.
Lindsay was swayed by positive reviews and a well-produced ad for Dr. Carlos Ramos, an uncertified plastic surgeon in Colombia who offered full-body makeovers for a fraction of the cost.
He's called the surgeon of Barbies. I was calling him a butcher by the end.
She signed up for a tummy tuck, breast reduction, and a bum lift, all for only $10,000, a price that was too good to be true. But right after the surgery, Lindsay knew something was wrong.
Through the tape, I could see a black spot on my nipple, and I kept asking what it was.
Ramos assured her that everything was fine, but it wasn't long before things took a turn for the worse. Lindsay sent photos to her sister, who was a nurse, and they got back to her immediately with terrifying news.
And she showed them to her doctor, and her doctor immediately said it was necrosis.
Necrosis is when your body tissue dies from not receiving enough blood flow. It's irreversible and can lead to a life-threatening infection, gangrene.
I was mortified, and I was ashamed and embarrassed, but also very angry that the doctor didn't tell me what was going on and kept telling me it was normal. and that everything would fix itself in 3 months.
Just 10 days after the surgery, Lindsay started leaking fluid out of her breast. Her stomach swelled, and she turned pale as a ghost. Despite all this, her surgeon, Carlos, still reassured her that there was nothing to worry about. But Lindsay wasn't convinced. She went back to Florida for treatment. Sadly, the necrosis worsened. She had to lose her nipple to survive. She spoke with a Colombian lawyer to get to the bottom of Carlos's mispractice and found out that Colombian law doesn't require doctors to have a degree in plastic surgery to practice. Carlos had been paying off doctors to sign official paperwork. He was part of a criminal organization of fraudulent plastic surgeons operating in Colombia. In 2016, he was arrested for the death of a Puerto Rican patient of his. He also faced charges of practicing medicine illegally, but somehow wasn't found guilty. Lindsay's recovery has been long and arduous. She had to wear a wound vac for months and spent a hefty $40,000 on multiple operations to repair her damaged body.
I was saddened to hear about a patient, Jocelyn Cano, who went to Colombia and had Brazilian butt lift surgery. So really involves liposuction and then fat re-injection into the buttocks. A very experienced surgeon will know when they're in the muscle and when they're in the fat. Here is a quick look at those blood vessels. You can see the blue of the veins and the red is the artery, and it's very easy to enter those with your tips.
An outpouring of sympathy on social media mourning the death of Jacqueline Smith, known as Miss Jackie O.
According to reports, Jackie underwent a gluteal augmentation procedure one day before her death. Jackie's death was confirmed on June 1st by a BET Media Group spokesperson. She was just 33 years old.
How much would you pay for beauty? Could you endure the pain of stretching your limbs? Would you try stem cell augmentation? Are you willing to die for the perfect butt? My butt! This is Your Body On, the top 5 deadliest cosmetic surgeries. There are many reasons to get cosmetic surgery. Did you see the confidence boost your friend had after their nose job? Sometimes it's just necessary, like breast reduction surgery to relieve back pain. Maybe a social media filter showed you what you look like with bigger lips and now you can't imagine life without them. Whatever the reason to get one of these appearance enhancements, don't forget, they're still surgeries. Anytime your body is opened up or you're poked in the name of achieving physical perfection, there's always a risk. Today we'll look at 5 procedures that can make you drop-dead gorgeous. Literally. Which surgery requires breaking your bones? Which one has been linked to a rare form of cancer? And how could a butt lift cause a blood clot? Number 5. Facial reconstruction. There are several types of facial surgery. Buccal fat removal is the process of removing fat from the inside of the mouth. But some people get this procedure without having much fat to begin with and end up having a hollow look. If the surgeon has trouble finding the fat pad in your cheek and punctures an artery instead, it could cause excessive bleeding. If you want to go in the opposite direction and get filler injections, make sure hyaluronic acid is being used. It's naturally occurring in your body, and doctors can melt it away if something does go wrong. And if you get Botox, don't rub or touch the treated area for 24 hours so it doesn't get pushed to other parts of your face. Number 4. Breast implants. There are 2 main types of breast implants, smooth and textured. Both carry risks like inflammation, leakage, and infections, which can lead to the implants being removed. But recent findings by the U.S. Food and Drug Administration have linked textured implants to anaplastic large cell lymphoma, a rare type of cancer. Another form of breast augmentation involves using fatty tissue taken from your stomach or thighs and then injected with your own stem cells. But this comes with no guarantees. These cells can still be unpredictable, and you'll notice when things go wrong. If some die off, you may have an asymmetrical appearance. Number 3. Tummy tuck. With a tummy tuck, surgeons will remove extra fat from your abdominal wall to tighten your muscles and flatten your abdomen. There are several risks associated with it, including blood clots, numbness, and fat necrosis. There's also a chance of your stomach looking uneven or lopsided. In April 2022, a 29-year-old Australian woman underwent a tummy tuck. 8 days later, she started to feel sick. The doctors gave her antibiotics, but it turned out she was fighting a flesh-eating bacterial infection. She had to be put in an induced coma and was given hyperbaric oxygen therapy to help stimulate the recovery needed after daily surgeries to remove dead tissue. Number 2. Leg lengthening. Want to be taller? Now there's a way. And it'll only cost you $150,000 and a lot of pain. You'll have to endure the femur in each leg being broken and extendable metal nails being inserted that will add 1 millimeter daily to your legs over the next 3 months. You can gain about 8 centimeters or 3 inches of height, but you could sprout to 15 centimeters or 6 inches by adding nails to your tibia bones. The recovery process is extremely painful since muscle, nerves, and tissue will all be stretched. If your leg skin feels hot or you have a fever, go to a hospital immediately. You might have an infection that needs immediate attention. After you reach your desired bone length, you will need another surgery to remove the nails. Number 1. Brazilian butt lift. With the fat grafting needed for a butt lift, surgeons make an incision in your skin and remove fat using a tube, usually from the hips, stomach, or thighs. They then purify the fat and prepare it for injection into your glutes. Sometimes the body might absorb the grafted fat instead of storing it. This means you'll need to undergo 1 or 2 more procedures. Buttocks are full of blood vessels. If the surgeons accidentally inject the fat near or into large veins, it can travel to the lungs. This is called a fat embolism, and it can be deadly. They must also avoid injecting the fat into the gluteal muscle. This will give the fat a direct route to the heart and lungs, killing you instantly. After getting a Brazilian butt lift, you'll need to wear a special compression garment and sleep on your side or stomach for at least 2 weeks. If you notice shortness of breath, fever, or a feeling of confusion, you may be experiencing an embolism. You need to seek medical attention immediately. If you want to get any cosmetic surgery, make sure your weight is stable, stop taking blood thinners, and avoid smoking for at least a month prior to the procedure. Most importantly, do your research and make sure to go to a board-certified doctor. All of these deadly cosmetic surgeries are hard on your body, but at least you're not conscious while they're being done. Do you know who doesn't use anesthesia during their procedures? Tattoo artists. Getting a butterfly on your ankle sounded like a good idea, until you felt the needle on your skin.
My name is Victoria. I've worked really hard to lose almost 200 pounds.
Being overweight most of my life was not easy, and when I finally lost all of the weight, I was so excited. I decided to have skin removal surgery. I was really scared for skin removal because it would be the most invasive surgery I had ever had. I ended up choosing the third surgeon I met with, and man, things went downhill from there.
I trusted a board-certified plastic surgeon who left me absolutely botched. I only agreed to the vertical and horizontal incisions, aka the fleur-de-lis, because I was told I would be totally flat and it would be done all in one.
I noticed that when I woke up from surgery, and I knew that something was not right. The pubic lift was done absolutely poorly. The front incision has left me with what looks like, well, I'm sure you can see what it looks like. The original surgeon is not willing to do anything.
And not only that, but she's admitted to causing an infection by prematurely pulling a drain, which led me to a wound vac, a closure, and 3 total surgeries.
That was just the start of many problems. My complications included several ambulance trips to the hospital, continuously being sent home from follow-up visits with excruciating pain, and ending up having to call 911 for myself.
Now, don't get me wrong, I know that there's cases where you need revision, but I was told if I wanted a revision, I would have to pay because my surgeon believes that this is a job well done and I have body dysmorphia. It was pretty upsetting to be gaslit, especially looking at it knowing how awful it looks.
Instead of just a paniculectomy, I was told if I did the cosmetic upgrade, I would be totally flat, and that I would be trading all of that loose skin for a scar.
The way I would normally treat something like this would be to perform the tummy tuck over again. So essentially you want to make a cut into the lower tummy, lift the skin up off of the muscle layer, and then pull that skin back down, cutting off as much excess as you can.
I was tagged by a bunch of you on Victoria's recent video that she posted. Skin, when you've lost a lot of weight, can be a little unpredictable, but I think she'd be a great candidate for a revision and get the result that she's happy with.
It still hasn't really hit me that after losing almost 200 pounds and having what I thought would be the skin removal procedure of my dreams, I was left looking like this.
I don't let what happened to me stop me from reaching my goals and going to the gym daily.
I chose to lose the weight because I was uncomfortable and unhealthy. Being fat didn't make me any less of the person that I am. I lost the weight because it was my personal choice. There are people who are beautiful, all different shapes and sizes. I was just uncomfortable in the skin I was in.
I went for a consultation locally, and I was told I would have to have a full redo of the entire surgery and then some. And I was just devastated to find out it is an almost $20,000 procedure to have done. I, as a self-employed business owner, mommy of 2, and to spend that kind of money, or to have to take out a loan and pay for something that I already should have had done, and nothing was made right, nothing was even offered to, pay another surgeon to correct it. There was no meeting in the middle.
One of the hardest parts of being botched is trying to wear things that I thought I would be able to wear, and it shows through everything.
But for me, I just didn't hold the confidence. And even though I'm dealing with all of this, like, to be able to put something like this on and wear and like feel okay at least, that's a win for me.
A few months ago, I started sharing my journey with you all on social media. And even though there's been some hateful comments, it's brought beautiful things. This upcoming week, I have a consultation with a surgeon who reached out, and if I'm a good candidate, the surgeon's going to do my surgery for free. I have been getting so many tags in all of my videos from you guys, and someone had tagged the surgeon, and he responded to her comment, and that person is amazing. Forever grateful for her. Thank you. He had responded to her comment, and he wrote, "I'll revise it for free if you want, thumbs up emoji." And I was like, whoa.
I thought I was dreaming. I, did my research, looked at his Google reviews, looked at his website, his Instagrams, and he's so reputable. His work is literally art. I called his office the next morning and I said, I believe your doctor, your surgeon offered to do my surgery for free. And I just want to see if this is real. And so she contacted him, he called her, and he said, yeah, it's real. And I was just like immediately sobbing on the phone with her. Like, I could not believe it. And I never in a million years imagined that me sharing this story on TikTok would lead to where I am right now and this possibility. And I'm forever grateful to all of you. This is like such an incredible, amazing blessing of a gift.
I now have this amazing opportunity with a new surgeon. News reporters have been contacting me and interviewing me, and I just feel so blessed with all of your support.
I can't believe it. Seriously.
Botox is used and abused throughout the world. If you can afford it, Botox can help you look more youthful.
Honey, you finally got Botox!
But too much of it could make you look a little strange.
I must look ridiculous. No, I don't think anyone will notice.
Are you fed up with anti-aging products that don't work? Could Botox injections get rid of those pesky wrinkles? How long would it take to get a youthful appearance again? And can too much Botox ruin your face?
They called me Botox because even though all the ladies want me, I will wreck your face.
This is your body on too much Botox. Botox is a neurotoxin that prevents muscles from moving by decreasing nerve signals to those muscles.
I can't feel anything.
In the 1970s, scientists used it to treat strabismus, an abnormal alignment of the eyes. The FDA approved it after seeing the results. Nowadays, there are more than 6 million Botox treatments done every year. That's an increase of more than 700% in the last 20 years.
You re-roof your house, why not do a little something on your face or on your body?
But even though it's popular, there are many risks to your body. How does Botox soften wrinkles? And what other uses does Botox have? Your first injection. All right, so you're looking to smooth out those crow's feet and say goodbye to wrinkles. But before you start, the healthcare worker may rub an anesthetic cream over the area so that you don't feel anything. It takes a few minutes to inject the Botox. The toxin will block signals from your nerves to your muscles, making them relax. Great, you're all set. You should start to notice results in about a week, but before we reveal your sexy new self, did you know Botox isn't just for beauty?
What?
Doctors often prescribe it for chronic migraines and even overactive bladders. It's also a standard treatment for excessive sweating, known as hyperhidrosis. Yeah, it blocks the nerves that activate sweat glands within 2 to 7 days. So, if you're worried about that injection, don't sweat it. After the procedure, you should avoid vigorous exercise for at least 4 to 6 hours after your procedure. Oh, and don't touch the area where you got your Botox or lay down on it either. Otherwise, the toxin could spread to other parts of your body. But we'll get into that later. Headaches, eye redness, and irritation are common side effects after a Botox injection. You could also experience some redness or bruising around the injection area. You'd be at a higher risk for these symptoms if you're taking a blood-thinning medicine like aspirin or drinking alcohol. Don't worry, you'll see the beautiful new you soon. 3 days after the injection. You'll notice you have fewer facial lines and wrinkles. Why do you look so surprised? Oh, right, that's just a symptom of Botox.
I'm sorry. Oh, sorry about what?
Raised eyebrows are common because the muscles relax and the skin smooths out. The Botox effects will last 3 to 6 months. The results are temporary, so people repeat injections, usually twice a year. Botox comes in small, targeted doses, but what would happen if you had too many injections? Too much Botox. You're now determined to look wrinkle-free, but if you overdo it, there can be serious consequences. You've had 10 Botox injections within the month. The toxin will likely spread throughout your body. Botulism is a paralytic illness caused by the bacterium that produces Botox. This life-threatening form of food poisoning paralyzes face, mouth, and throat muscles. It can be fatal if the toxin spreads to the heart. After your 10th injection, your muscles will be weak. You'll have no facial expressions.
You can't show emotion for another hour and a half.
Your mouth is crooked and... Are you trying to smile now? I can't tell. Your eyelids are drooping, making it harder to see. You can hardly breathe, speak, or swallow. And your muscles are so relaxed, you lose control of your bladder. Wow, you shouldn't have left the bathroom. The safest way to use Botox is the less is more principle. Trust me, your body and your wallet will thank you.
I wish there was an undo button for this thing.
But now, if you want to modify your look in other ways, well, maybe you could try something more extreme. Well, to find out more, keep watching Your Body On.